Alright, so we're going to be talking about XCP kits here. We have two XCP holders that are called snap arrays. They're just a little bit different, but they work in the same manner with a little bit of a twist for each one of them. We're also going to be talking about the film placement using either one of these. First part of it, of a snap array tool, is that it is for the bisecting angle when we use that technique for taking dental films. We have the jaw portion right here, and this is going to be holding the x-ray film. We also have a little locking circular ring right here that when it slides right over there, it allows these jaws to stay shut, holding our x-ray film secured. This is going to be the part that's going to be primarily used for the posterior teeth. And then if we go over to the anterior teeth, we have these forks right over here that has a little area where the film is going to slide in and be held. There's one that's for the back that holds and supports the film, and we have two forks in the front that are going to help us place our film in the specific area that we're going to be taking the x-ray from. When it comes to this part of the snap array tool, we have it opened and we have two different areas. We have one that's a thicker side, one that's a thinner side. The thicker side that has almost like the part where the eyes would be, almost looks like an alligator. This is going to be the area that the teeth are going to bite on. So when we have this in the mouth, this is going to go in. Say if we're on our right side, it's going to go in, they're going to place it in there, and they're going to bite down. The larger side, or the larger, thicker end, is going to be the one where the teeth are going to bite down on. If I was going to have my film placed into here, for my right side, the thicker end goes off to the right side. I'm going to have my dot, and since we don't really have a slot, but we're going to be putting it where the teeth is going to bite down onto the dot, just as so. It's nice to leave a little bit of extra film sticking out right here at the bottom, in case when you're doing the bisecting technique that you're not going to miss any crowns when you take your film. We're going to lock the ring right onto that, and that holds that film nice and secure. Going over here, teeth go on that side. We're going to place it into the mouth just as so, and then we're going to bite down. Now, for placement, if I was to go for the lower teeth, the only thing that needs to change, because still the teeth are going to be biting on here, is I'm going to change the direction that the film's in. So changing it from the top teeth, and we're going to go to the bottom. We're just going to take our film, rotate it around, and then we're going to bite on the dotted side still. After which point we go over, lock it, leave a little extra on top, and that's ready for the bottom. We just place it and then do our angle and take the shot. So that's all it requires for one side, is just taking the film and putting it in a specific way. If I was to say go over to the other side, if I go to my left side, we have to change this around. Just flip that over. The larger, thicker end is going to be on the cheek side where the teeth are going to bite into it, and you do the same thing. Place it in there, lock it, patient opens, they'll bite down. Go into the bottom, just rotate it over, and bite down. When it comes to the front ones, for the anteriors, it's as simple as just taking it. Locking the ring is nice so that this doesn't open and close the whole time you're doing it. And just slip it in there. When we do our placement for our teeth, you're going to put it in. Let's say we're going to take an anterior central shot. When I place it in, I want to make sure that these two forks that are sticking out, these two prongs, are outside of the incisal edge. This will allow it so that when I take my bisecting angle shot, that I still have the crowns of my tooth in there. If I was to go over to the centrals, or from the centrals to the canine, I still have those forks sticking out. So that extra film is going to be there so I can capture my crowns of my tooth. It also can be used so that right here in the center of these two is where you're going to be placing the teeth that you're going to pay attention to. So the canine goes right there in the center of my bite forks. Two centrals go right in the center of my bite forks, right in the middle. Same thing for the lower. Going to do this, Make sure that the bite forks stay outside on the incisal edge. Going over to the canine in the same direction. For our other one that we have here that's more colorful, everything's the same type of method. It just has a little bit more of a cushioning, as you can see on this end, for the film, instead of it being these real rigid teeth that bite down on them. Everything's the same on that end. The only thing that changes that's different is the anterior portion, which you can see the little difference is one of them's just a flat end that just goes straight out, and this one, it more resembles our XCP anterior holder as we have right here, in the same type of notion that it just goes and angles upwards a little bit. The only differences that we have on here is that it has a little bit of a elevation rise at this point. This simulates our cotton roll that we would be using on our XCP kits to allow us to not miss our coronal portions of our teeth. Just go there, slip that in. This part is going to be the part that the patient bites on. Just as so, we take our shot from there, but still doing a bisecting technique. All right, so when it comes to our actual patient, when we're going to set up or do our thing, usually I start from the top right, then I go to the bottom left, top left to the bottom right, but we're just going to go in order and just clear the whole maxillary arch, then the mandibular arch, and then we'll end on our bite wings. So I'm going to start on my right side. I'm going to make sure that my larger end is over here towards the cheek side. I'm going to bite down on the dot, leave a little bit extra underneath. Now I'm going to lock that tight, give it a slight little curvature just so that it doesn't hurt the patient as much. Going into the mouth, I'm going to start it horizontal and I'm going to roll it into its place. I'm going to make sure that I'm all the way back far enough to be able to get my molar shot, and that's where the placement ends right there. I'm checking to make sure that my film's all the way past the distal of the second molar, which I have in this patient's mouth. And then I need to identify certain things about where do I aim at. Well, let's first by starting with where is my film ending at. So when we go over here towards our dexter, when I'm looking down, there's going to be this line that is right towards the end right here. Right in this spot is where your film ends. So I know if I was going to aim my PID, I don't go past that spot. So here, if I was to horizontally place my PID, it should line up or slightly just be off from that line that we have right there. So let's look top down, move it over, adjust it a little bit, and that would be good for my distal shot right there. Or my posterior shot, I mean. So now going back to our position right here in front of our patient, we are going to check what type of angle that we're going to be taking for this bisecting technique. So top right for the molars, as this might say, this goes towards positive 20 to positive 30. If you're wondering what positive or negative that they're talking about, going over to my actual x-ray tube head, if I look up towards the top, there's going to be a line that's attached to there, and with a different change in degree, that line moves. The numbers over here dictate what degree that I'm taking, and it starts at 0 as horizontal, and as I go backwards, as I raise or as I lower the back end of the tube and it raises the front, that's a negative degree. So if I look at my line, it's telling me I'm at negative 20. If I was to raise the back end of my tube head and the front end is lowered, then I look over there and my degree angle is positive 25. So when we look at our sheet here in a second, that's going to tell you a bunch of negative and positive angulation recommendations for taking a bisecting technique x-ray. So placing this right back here in front. If I was going to take a positive 20 to positive 30 angulation, I know that ends right there. What I can do is I can bring it up to my patient's face, and I can hold my hand out as if it's an extension from my cone, and I can level it out just as so. So I know that anywhere underneath where my hand's touching this snap array instrument, I should not be anywhere lower than that. At which point I can then start angling and raising as I'm angling my PID to an appropriate level. So right now I'm at a positive 25 degrees, and I should be lined up with my film. Now I believe for myself I want to take a little bit more of a positive angulation, so I'm going to bring it up to 30. And right now I'm going to raise it up a little bit so it's in line with my film, and that should be my shot for my posteriors. Now the main thing, as we always should be doing, is aiming between the contacts. So always be able to aim between the contacts, so you always have an open shot so that nothing's overlapping. If I was to look directly underneath this, I can see a line also, and I can use that line to aim right in between my specific molars. So I'm going to aim right here between number 2 and 3. I should be lined up, so nothing should go wrong with cone cuts wise, and my angle should be within that recommendation line, plus or minus 5 degrees. So positive 30 at the moment, angling at a molar shot. I would go and take my x-ray if I have my control panel set for a molar. At which point, when we're done, we'll get a new film. We'll go over to our premolar set. I want to make sure that I get at least to the distal of the canine, so I have all of my premolars in the shot. So I'm going to use that red mark as an indicator to say how far forward my film is being placed anteriorly. And once I have that, I have a different degree, so positive 30 to positive 40. I'm going to go forward. You can pre-angle this before we even place it in the person's mouth as you get more used to and accustomed to specific angulations. At which point I just have it angled. I'm just going to aim it, make sure that it doesn't make sure that my beam isn't lower than where my film is to prevent cone cutting. At which point, always make sure you're going through the contact of whichever one you choose. So I'm shooting between 4 or 5. I should have it angled. Right now it's at about 38, 39 degrees, and I would take my shot from there. If I was to go for the lower arch for the molars, I'm just going to go get my film, a new film, and make sure that it's facing downwards with the wider side towards the cheek. And then we're going to place it in the mouth, making sure that that end of the film is distal, a little bit more distal to the last end of the tooth. So I can see my molars right there. I'm going to line up my x-ray head, and for a lower molar, the degrees is a negative to is a 0 to negative 5 degrees. So not that much of a difference from horizontal to just do a little bit of a change where our front end is facing upwards and our back end is lower. So I'm just going to aim it just as so, making sure that I'm within the red line showing where my end of the film is. So I'm going to do just about that. So right now I'm going to take a negative 8 degree shot for this molar, at which we're done with. Make sure you always go for it between the contacts. I'm going to take another shot for my premolars, making sure it gets at least farther enough to get the distal of the canine. And I'm going to take a little bit more of an angle, so negative 10 to negative 15. Just going to angle a little bit more, see my film. Right now I'm at negative 15. I'm just going to go a little bit more. Make sure that everything lines up so that you're still on the plane to hit the film that's behind the teeth. Take the shot from there. Now for our anterior shot, this one's going to require the help of a patient's hand to hold our instrument. So with this one, I'm just going to place it into there, and I'm going to go and take my canine shot for the upper right. So for this one, it's good to always pre-angle. So I'm at positive 45 to positive 55. So that means I'm going to take a really downwards angle so I get just right about to that degree line. So over here, you can see that my line is right there at about 45 to 50 degrees. I'm going to have them placed there, and it's recommended that they can bite down. But don't have them bite down all the way, because if they bite down all the way, it's going to make my tool or the film horizontal, and we don't want that. We want it as much up against the tooth as possible. The patient, you're going to instruct them to hold this with your left hand or your right hand, whichever makes it easier, so that when you're bringing your x-ray around and you're trying to aim, that it doesn't hit their hand moving the tool. But I'm just going to have that placed right there for the canine. Make sure that the canine is centered right in the middle of the film, with the two forks sticking out of the sizal edge to make sure that we don't lose any crown of the tooth in the shot. I'm going to take my 45-degree angle, and I'm going to line it up, making sure I get everything in the shot. So with this, just as so, I'm making sure that everything's lined up. This bottom line is going to help me be able to see that's lining straight into the canine, or if I wanted to open up the canine and lateral contact, making sure that that's opened. At which point, you're just going to tell the patient, hold very still, go out and take the picture. We are going to do a central shot. Same thing. Have them slightly open. They don't need to bite down all the way. Make sure the two forks on the outside. Pre-angle to make sure that everything goes a little bit quicker. You're going to go and line it up so that your aim is right directly onto the film, so that you can bisect the tooth onto the film with as little distortion as you can. And then going back over to the canines on the other side, you're going to do that 45 to 55 degree angle and line it up and take your shot. As another option that I've been able to do is without the use of the snap array or the XCP kit, is with a really high degree angle, just laying your film straight down onto the teeth, have them bite down so it's nice and flat where the maxillary anteriors. Leave a little bit extra out in the front so that we can get our crowns still. And I'm going to take a real high angle and bisect that tooth onto the film so that everything gets in there without the use of a tool if I so happen not to have it. That's really simple for the maxillary teeth, but it's a little bit different when it comes to the mandibular. The mandibular ones, when we take those films, same thing. Make sure that they're not biting down all the way. If I was to go to the degrees on the mandibular, it's -5 to -25. So that means my cone head or my X-ray head is going to be, the rear is going to be down, the front's going to be up. So right now I'm at a -15. If I was to go and place this for the maxillary or for the mandibular incisors, you're going to want your patient to go and bring their chin up to everything is nice and leveled, so that everything's nice and horizontal. You do not want them to bite down. Make sure that the forks are still sticking outwards, and you're going to have them hold on with their hand with whichever side is away from the X-ray head, so nothing gets moved. So right here, I'd probably have them hold on with their left hand. I'm going to go under, aim that shot at about 15 to 25 degrees. Right now I'm at right in between, about 20. I'm going to use more of a 25-degree angle to take that shot. Make sure everything is nice and lined up so there's no cone cuts, that you're hitting all parts of the film. Take your shot. Same thing with with the canine. You're gonna go line it up, make sure that they're not biting down too much. Go, and we're gonna take a -20 to -30. Right now I'm about 25, so we're right in the middle. I'm gonna take a -30-degree angle, make sure the film and the PID is lined up so that nothing gets missed. Have your patient hold it, go take your shot, and be done with it from there. When it comes to bite wings, you can still use the bite wing tabs, which is very much recommended. If you were to do the bite wings with such method as your snap array, you just put it straight directly in the middle, have it bite down, and you have your patient just bite into place for whatever you want to go to. And just as we've done with many bite wing things before, make it either a 0 to a +10 angulation, in between the contacts. So I just like placing it as if I was going to take the x-ray, rotating it down, choosing a contact, and using this line as I rotate it upwards to slice through the contact until it's within the degrees that I'm using, and take your shot. The only issue that I don't like with taking our bite wing x-rays with the XCP or with the snap array kit is that it does not allow the patient to bite down all the way. They have a little bit of area where they can still stay open, like 3 to 5 millimeters of them being open, and that might risk us not seeing the proper level of bone that we would want to see on a bite wing x-ray. So sometimes it's just easier or more beneficial to use the bite tabs that are little stickies that you just stick right onto them. As the other option, you always have the one that is a little bit more colorful, and it has a little bit of an elevational raise right here for the anterior shot. With this one, you won't need your patient to hold the x-ray, because when they bite down, such as in this anterior shot, it just holds into place as they bite down. You will want them to bite down at that point. You'd still take the same angulation that you did before, which is about 40 to 50 degree positive, and you're going to take the shot right there and get that. Do the same thing for the canine, and for the mandibular anteriors, you'll do the same, and it works in the same way. Just as so.